Brenda, and I recruited Dr. Jen to help today, but we're going to do a couple of core exercises that are safe for pelvic floor and any core issues like a diastasis. So these are all really great alternatives, and I have 3 of them lined up for you, and they progress in difficulty. So we're going to start with the easiest one and then go to the hardest one. But feel free, you can incorporate these in with your current workout. You can swap them out with some of the other exercises. We'll talk a little at the end on just how to modify some of your exercises too if you have pelvic floor issues. So stay tuned at the end for that. The first exercise I'm going to have Dr. Jen do, it's called the TA March. So TA is our deepest ab muscle. And what she's going to do is put her hands on kind of the bony bumps of her pelvis. And then she's going to draw her belly button down and in, kind of like she's zipping tight pants. So ideally you want the back to be about flat on the ground, and you want her drawn in. A lot of people will tense and squeeze everything. Yeah, we don't want that. So you're not tensing like you're going to get hit in the stomach. You're drawing down and in. So she's going to do that first. So she's going to activate the TA, hold that, and then she's going to lift one knee up just a couple of inches, and then back down, and then she's going to lift the other one. Good, and back down. And the whole time she's trying to keep a nice stable pelvis. So you don't want to see a lot of rocking or shifting on the hips, and you also don't want the back to be arching up with that. So this is the first one, and this is kind of the first exercise you would do to retrain that TA muscle if you've never done that. So this is a good one for anyone to do. Now what I'm going to have her do is come up on the hands and knees for me. And this is a progression, so next step up. But what she's going to do here, same thing, she's going to activate that TA. So she's drawing belly button in. You want kind of a nice flat back here. And then what she's going to do is lift one leg straight up in the air, just enough like she's sliding a piece of paper under it. And then she's going to kick it back only as far as she can without arching or really rocking or shifting the hips. And then she's going to alternate sides here. So lift first and then extend out. And then you can kind of relax that TA in between, reactivate if you need to. So I always think of like kind of lifting straight up and then kicking back, which helps me, pulling that side in. So now what we're going to do is the hardest one. So if you haven't been doing any kind of core stuff, maybe don't jump into this one. But this one is kind of like a modified plank almost. But she's going to tuck her toes underneath her here. She's going to draw that TA in. And then what she's going to do is lift both knees off the ground at the same time, just about 2 inches. And you're just hovering for about 5 seconds. And then come down and rest. And so when you're doing this, you really want to think of drawing in, again, nice flat back here. You're not arching through the back, and really nice stable pelvis and hips with this. So not a lot of rocking or shifting, and pretty much everything else is staying still on her as she's lifting. So just the knees are coming up and you're hovering. So this exercise is pretty difficult. Jen's probably getting tired here. We better make her stop. Okay, you can rest. So those are kind of the progression of exercises. The last thing I just wanted to touch on briefly is how to modify a couple things. So if you're having pelvic floor dysfunction or even diastasis recti, you really want to avoid crunches or any kind of exercise that's really putting a lot of pressure through the abdomen. So things like a Russian twist, like if she was lifted up here more too. So she's, so these these aren't great because they really put a lot of stressor there. So there are things that I try to avoid if possible, as well as like crunches and sit-ups too. They're just not super effective either. So those things, try to avoid them. And then if you are having symptoms, say with a prolapse, you're having a lot of pelvic pressure, you want your symptoms to kind of guide you. So if you're doing some kind of exercise and you're having more symptoms, then try to scale back. Maybe you need to cut back on some of the resistance or some of the intensity, because that's your body's way of telling you it's a little too much. So listen to that and try to modify it. It doesn't mean don't do any exercise and stop moving. It just means maybe scaling back a little bit until you can get strong enough to then go back into that. And then the last thing is really making sure you're breathing well. So when you're doing a certain exercise, breathe with the exertion. So if you're doing squats, the hard part is trying to come back up from a squat. So really make sure you're exhaling as you lift back up. That's going to prevent you from holding your breath and increasing that abdominal pressure and putting more strain on the pelvic floor and all of those structures. So really make sure you're breathing well, you're not holding your breath, and scale back if you need to. So hope this helps. If you have questions at all about any of the exercises or what you can do, reach out to us and we would be happy to chat. So have a great day, everybody.